just give us a few minutes. We want to make sure we have Richard Shaves, who is our third panelist, unfortunately has COVID, so wasn't able to get to San Diego, but he's going to be joining us via Zoom.
I'm here.
Oh, you're there. Where can I see you? We need to, Stephanie, can we get this screen shift? No, we just need to screen, Brent, can you do that? Yeah. Hi, Richard.
Hello, just pretend I'm sitting in that other chair.
We would like to do that. Okay. All right, so thank you. All right, then we can get started. We're ahead of the game. This is great. So I've already been introduced. As you know, the think tank is first and foremost a scientific meeting. But Beacon is a patient advocacy organization, and we're always centered on improving the lives of those people impacted by bladder cancer. And from the first think tank in 2006, the patient voice has been an integral part of that meeting. It's always our goal with this patient voice panel to introduce you all to the many faces of bladder cancer. While we know that a bladder cancer patient, every bladder cancer patient is unique, an N of 1, we also recognize that there exist these images or ideas about the typical bladder cancer patient. And if I might say so, when I first got involved in the bladder cancer field in 2000 when my husband was diagnosed, I would say that typical patient was an older white male. And I'm of the belief that that's one of the reasons why it took so long to get bladder cancer the recognition that it needs. It is not just older white males who suffer from this disease. So each of today's speakers represents what we think or we would consider to be an outlier of bladder cancer. And they're going to share with us their experiences, including delays in diagnosis, as well as the need to be a strong advocate in their treatment to ensure the best possible treatments. So it's my pleasure to introduce our panel, Brent Ulbert, Angie Glinder, and Richard Shaves, who's joining us via Zoom. I'm going to ask each of them to provide a short summary of their bladder cancer experience, and then we'll get into our discussion. And as always, we'll leave time for questions from all of you at the end. So I'm going to start with Brent, who we've invited as the voice of the young person diagnosed with bladder cancer. Welcome, Brent.
That's me. Thank you. First, I just want to say thank you to all of you. This is kind of like being in the Chicago Bears locker room. There's a lot of heroes and incredible people that mean a lot to me in this room. Is Dr. Bupathi here yet? I don't know when. I heard he was going to be here. I don't know when his flight got in, but my oncologist is supposed to be attending this. So that was a surprise to me recently, but that's part of the reason why I'm here, because he did his research and I'm still around. So a little bit about me. I was diagnosed with bladder cancer in March of 2020 after close to 2 years of trying to figure out why it burned so much when I peed. March of 2020, I don't know if all of you remember, but it was a pretty tumultuous time, not just in my personal life. My wife and I had been trying for a baby that was that she had just told me we were expecting, and we were moving into our new home, which we had been building for the past 14 months. And then there's this weird disease that was all over the news. So we signed our lives away. We figured if the world was going to end, we should do it in our dream house. And I had my first TERP in March of 2020. So quarantined and did chemo, did MVAC. By August of that year, I had finished my MVAC. I had a radical cystectomy. So my bladder is about 2 months older than my son. You might see him towards the tail end of this. He's 3. He's up in the pool and just getting dressed right now. And then had a couple years where I thought I was cancer-free, but thanks to surveillance that Dr. Bupathi had found with Signatera testing, we were tracking my cancer was going up, it was going down. We weren't really sure what to expect, but he had learned of this new treatment. He told me Brent, I don't know, it keeps going up. We should get a PET scan. So I got a PET scan in 2021, and it turns out that my lymph nodes were 2 millimeters enlarged, which, you know, as all of you, most of you in this room know, that can happen from the flu. But since I was a cancer survivor, we immediately knew that it was back. I did cisgem chemotherapy, which we then changed to carboplatin because cisplatin was awful. And pretty quickly into that, I went back into remission. But getting rid of cancer is like putting out a campfire. So we did Bavencio, avelumab, immunotherapy, which I just finished about 10 weeks ago, and start to feel like a normal human being again. So 2 years cancer-free, and extremely happy to be here. Corner me at any point in time if you see me. I love to tell my story. I love to answer questions. And again, I'm just extremely grateful for everybody in this room. So thank you.
Thank you for that.
Well, that was the last day of my treatment with the Bavencio. We went and got tacos to celebrate.
That's wonderful. That's wonderful. What's your son's name?
Van.
Van.
Yeah.
Okay, that's great. That's great. Okay, and Angie, obviously not a white man, obviously not an old white man. Angie representing women who have bladder cancer and also with upper tract disease.
Hi, I'm Angie Glender, and it's a pleasure to, well, I don't know if it's a pleasure to be here because it means I get cancer, but I'm very happy to speak about my experience with bladder cancer. And I guess I'll start. I'm a registered nurse. I'm retired now, but so I know blood in the urine's not a good thing from the get-go, so that's one. And also, I'm a wife of someone who went through bladder cancer a few years before I had blood in my urine. So honestly, I thought, oh, I have what my husband had, easy breezy cancer. In other words, he had a TERP done, then he had the other one done, and he had BCG, and it was successful. And it's like he's not ever had cancer, and it's lovely. And you worry, but I said, oh well, there you go. I know the process. But of course, I one-upped him. And I ended up having my cancer in my upper tract. So my cancer was in the renal pelvis of my kidney. And so my path was different. So they found my cancer with the CT scan, the urogram, before they even looked and did a cystoscopy because it was scheduling issues. And I first went to doctors that were close to us. And the process was so different once we found out it was upper tract that it was like, oh, let's take the kidney out. And I'm like, whoa, wait a minute. Let's look at this and see what am I supposed to do? Is that really the right path? And through Beacon and a webinar that they had, which was UTUC, which was the best. I even printed it out, but it's there, it's great. And so there's different options. And we ended up seeing doctors at UNC Chapel Hill, and we went with neoadjuvant chemo first. And I figured every percent, and I love my oncologist there, Billy Kim, and every percent in your favor that's going to help you, I figured I'll take. You know, I'm young, I don't have any other disease, well, young-ish, I'm not young. You know?
You're young.
And then I didn't have any other disease processes, so I figured, well, 5% here, 7% here, 10% here, it adds up. So we did the chemotherapy, which isn't fun, and then I had a great surgeon who did the robotic method, and which was great because I'm not cut open huge, and they took my kidney and ureter. And this all started in 21, spring of 21, had surgery by end of September, and so it's almost 3 years, NED, no evidence of disease. I just learned that too, the NED part, because I'd say cancer-free, and it's like, well, no evidence of disease, so yeah, so it's all good. And then actually September, I have a cysto again. And I do like those, not cysto, a urogram. Because since my cancer originally was up high, it wouldn't have been found in the cystoscopy. So even though people don't like all these procedures and tests, and I welcome them because then I know I'm good. I'm good for another X amount of months, or I'm good for however long. And now it's a year. I have years between mine, and so that's a little scary, but yeah. we'll see. We'll see in a month.
Thank you for sharing. And now I'd like to introduce again Richard Shaves, who's joining us from Oregon, right?
Correct.
And Richard had a diagnosis of both small cell carcinoma as well as squamous. So please join us.
All right, thank you. Like the others, it's an honor for me to speak to all of you today. I wish I could be there so I could talk to you in between sessions, but maybe next year. I live in a small community in Eastern Oregon, Baker City. There was 10,000 people there when I was born, and there's 10,000 people today. Boise, Idaho, it's about a 2.5-hour drive is the closest medical center. So one day in July of 2021, we just got back from a 40-mile bike ride. And before anybody thinks, oh, this guy must really be heavy into exercise, they were e-bikes. And I went to the bathroom and there was blood in my urine. So we contacted our internist in Boise, who is awesome. And she said, well, you probably just bumped something, but you should have an ultrasound. So I had one. And the same day she got the results, she called us. And in fact, we were at the airport getting ready to get on a plane and didn't after the call. And she said, the ultrasound shows that it looks like you have a tumor in your bladder. And then that same day, she got us in to see a urologist in Boise. And he said, no, you don't have a tumor in your bladder. You have 2 tumors in your bladder. And he removed both of them the next day and sent a sample to pathology. So it took about a week to get the results back. This was during COVID. And it came back that those 2 rare cancers that you just mentioned were in the wall of my bladder. And so the St. Luke's team in Boise said, well, with the protocols we usually use, you have about a 30% chance to beat this. And they said, we highly recommend you go to MD Anderson Cancer Center. Well, we had never heard of it, but we trusted our internist, so we went. And at MD Anderson, our oncologist, Dr. Al-Halabi, who I think is there today, prescribed a protocol called IAEP, alternating doublet treatment. And it was developed by an associate of Dr. Al-Halabi. Well, after recovering from the 4 5-day-long in-hospital chemo treatment sessions, I had surgery. And the surgery, in terms I can understand, they took out my bladder and my prostate, as well as 21 surrounding lymph nodes, and they put in a conduit urinary diversion. So altogether, we were in Houston for 7 months. Today, I'm cancer-free and 95% certain it will not reoccur. We have so much faith in Dr. Al-Halabi and MD Anderson that we fly to Houston for our checkups, which will become annual, like yours. Starting this year, I'll be 3 years cancer-free. As far as quality of life goes, I live a normal life. It's excellent, without restriction, except no spicy foods. And if I had to narrow down the reason for my success to one word, it would be support. Medically, mentally, and emotionally. My Boise internist knew where to send me and encouraged me in a caring, compassionate, factual way to go there. My oncologist at MD Anderson, Dr. Al-Halabi, gave me confidence that we could beat the cancer. During our first visit, he said with our treatments, I had an 80% chance of survival. He was very factual and scientific, but he was also totally compassionate and caring and spoke in a way that I could understand. I'll always remember at every appointment with him, he would sit knee to knee with me and look me straight in the eyes and then talk to me as long as I needed. In fact, everyone at MD Anderson was really motivated. That support was awesome. My wife and my caregiver, Kathleen, I couldn't have navigated through all this without her. She always had a positive outlook. She got me to all my appointments. And she took care of me when I was back at the apartment. In fact, after we first got the treatment plan at MD Anderson, I needed to have my first 5-day chemo treatment in 4 days. And she flew back to Oregon and drove 2,000 miles back with things from our home, including our 2 doggies, so that I'd be comfortable when I got home. She updated our friends and colleagues through a free online app called the Caring Bridge. So she only had to do it once, and then everybody we wanted to know about what was going on could just go look at that. That was a big help for her as a caregiver. And I'll just close by saying, lastly, a big support for me was my faith. Our favorite mantra over the 7 months, and even today, is faith over fear. Kathleen focused on that with me and on taking one day at a time and naming our daily miracles every day. So that's my story in a nutshell.
Thank you, Richard. And I think that's good advice for us all. We all need to be living our lives one day at a time and taking advantage of everything that we have in this, really living in the moment, because that's all we are guaranteed of, is in the moment. I want to follow up on a couple things, because Brent, you talked about when you were diagnosed in March of 2020, yep. But I know from my conversations with you that you had many symptoms before you finally got diagnosed with bladder cancer. Yeah. So can you share with us that part of the journey and how long it took you to get that diagnosis?
Yeah, absolutely. I would say for all the physicians in the room, don't skip the small steps, because I was complaining of painful urination for close to 2 years. And if I would have just given up, like, I always say, like, all the people I know that are afraid of doctors aren't really with us anymore. I have some family members like that. And I was like, no, this hurts. This isn't normal. I kept going back and back and back. They tested me for every STD in the book. I said, fine, ruin my marriage. I want this pain to stop. I don't care. They thought I had pudendal neuralgia for a little while from a mountain bike accident. They thought there was like a hip scar tissue in my pudendal nerve. So I did some fun physical therapy for that. That's mostly reserved for postpartum women. That didn't do anything. I kept journals of my diet. I keep a lot of journals, and speaking on what Richard said, I find it really important. I would encourage your patients to keep some sort of blog, like a private blog. I use Google Docs, and I just shared it with family so that I didn't have to have the same conversation 50 times. Then everyone could keep in touch, and they could send me, you go get them texts and stuff like that, but I didn't have to say the same thing over and over and over. But what really did it is my normal urologist that I'd been seeing to try and figure this out, he was out of town, and the doctor that was still there, or that was kind of the substitute for the day, was like listening to me, and he goes, have you ever done a urine cytology? I said, no, what's that? He goes, it's a P-cup test, it looks for cancer cells. I go, cool, let's do it. And 15 minutes later, they scoped me, and I was looking at my tumors. And I had TERPed a few days later, and I was like, thank God, because the pain was gone. Yeah. Like after TERPed, I was like, this is amazing. I can, it just doesn't hurt anymore. So yeah, it was just, don't skip the small steps. Don't look at someone and assume you can. If you don't get a negative test or something, do that test.
Yeah, I assume because you were a young, healthy individual that
probably.
Bladder cancer never was on the doctor's mind to even test you for that. Yeah.
Yeah.
Angie, how about you? Was there some delay in finally getting the right diagnosis?
It wasn't a big delay because I pushed the issue. But So I had blood in my urine like on a week. It's always a weekend whenever you notice anything or have an issue. So it was a weekend. And,
Or a holiday.
Oh gosh, yeah. I had a weekend holiday with the IV issue from cisplatin. Yeah, it was very difficult.
Yeah.
But so this was, so I had blood in the urine. I'm like, I'm getting seen. You know, I'm not, oh, it could be this. You know, no, it's cancer. I knew it, and because I had no other symptoms. I didn't have pain. I didn't have fever. I didn't have odor. I didn't have anything. I had blood in the urine. And so then I call my PMD, and I get in right away. She's great, by the way. But she's like, well, it could be a urinary tract infection. I'm like, no, I don't think so. And but I have to say I took the antibiotics anyway, because, you know, might as well hedge all bets. And my husband was seeing a urologist at the Levine Cancer Center in Charlotte, North Carolina. And so I sort of had an in. So we called, and I was able to get in fairly quickly. And we talked to him, and he's the one who scheduled the tests. He scheduled the CT urogram and the cystoscopy. And like I said, the CT was done first, and they found the cancer. So the ball got rolling quickly, and that sort of put me back because we didn't expect that UTUC. So then I had to like put the brakes on just a little bit to research before we took the route we did at Chapel Hill. But yeah, so I was on it. But who knows? Because I'm a woman and of a certain age, you know, you can be more prone to upper tracts. And it could have been a while if I would have just said, oh, yeah, you're right, let me take the antibiotics. Because I know you don't have continual blood in your urine. It's not like every time you urinate, you have blood in your urine. It could be a month from now that it would reoccur. So I'm glad I pushed the issue and found out, well, I'm not sure I'm glad I found out what it was, but I'm glad that I was able to get that taken care of quicker rather than later.
And you're here.
And I am here.
And I had 0 blood, just for the audience, nothing, not a speck the whole time.
No blood.
Until chirped, obviously, after that,
No
during
kidding.
the recovery.
So it was just the pain.
Not a speck,
But it was the
literally just the
significant
pain.
pain.
Yeah, just episodic pain over and over. It would get longer and longer. Yeah, so I think that's another reason it was overlooked, because they're like, well, there's no blood in this guy's urine, so it can't be that. But the tumors were right next to my ureter, so to me, it was probably the symptoms were a permanent kidney stone, right? It was just like constantly inflaming that area. But,
Yeah. And Richard, it sounds to me like when you related your story after you had the blood in the urine, you saw your doctor who got you care right away, so that there was not much of a delay in the diagnosis?
Between Dr. Karen East and my wife, those two women just drove the ship. And the only time there was any kind of a delay, and it wasn't significant, was getting full admission to MD Anderson. And again, my caregiver, my wife, she stepped in and she was on the phone until she was best friends with the admissions person. And we got admitted within 3 or 4 days. That was other than that, everything was completely on schedule for me. So it was one of those daily miracles.
Well, I think you all, we invited you on the panels because you are what we call these outliers. But I think you also are perhaps outliers because you all are very effective advocates for yourself. None of you sat back and just said, okay, we'll just take whatever the doctor tells me, and you all have done your research and worked very hard to get the best treatment and get the best outcome. And we know, unfortunately, that's not the typical patient. Angie, do you think that your medical team provided you with all the information you needed to make informed decisions?
I think the team at Chapel Hill was great. The oncologist sat with me, I have to say, and talked to me. And we talked because we hadn't decided on chemo yet. I just wanted to know if that was a route that we should take. And he spelled it all out. And he's like, it's not like magic. I'm going to have chemotherapy everything's going to be hunky-dory and I can save my kidney. We'll still probably need the kidney out because it ended up being a high grade. It's not something that you want to mess with in that area. So I'm like, well, okay, I get that. But what's it going to give me, you know? And so I like facts and figures and percentages. That's me, you know? I want to see anything that you tell me, I want the data behind it. Don't just say, well, you got to get your kidney out. Well, why? And why now? Or why this? I need all the facts. And in the first doctor I saw, which was great, he was just, let's get the kidney. And it was like, I had to put the brakes on and find out the best path to get the best outcome. Because I want to be around. I don't want this to come back, and that's always a fear. It's like, what, 40% chance that the upper tract will be in my bladder. So it can recur in my bladder. And it's like, well, and then I thought, well, that's okay, because then I'll still have my other kidney, and I don't want to lose the other kidney. And dialysis as a nurse, it's not pretty. You know, it's tough on those patients. And so, but coming to Beacon seminars, I find out that no, that's not necessarily good to have it in your bladder either. Just because my husband had a good outcome, you know, and he had the BCG and it was great and he still has his bladder. No, that's not for everyone, you know. So I could have major surgery again and then also lose my bladder. And so I want the best outcomes, you know. So whatever percentage you can give me, that's what I want to hear. And I thank Beacon for that UTUC webinar. Y'all got to see it. But yeah.
Brent, how about you? Do you think that you had all the information you needed? And if not, what might have been missing?
I think I did, yeah. I found Beacon. Now I can't remember if Dr. Bupathy told me about it or if I Googled it, but the case studies were what I really found comfort in. I'm very much an accept the facts guy and move on, so it was like, all right, this rocked my world, but the only way out is through. So yeah, I just came prepared with a lot of questions, and you know, my team always had the answers that I needed, and when they didn't, that's when I looked for others. But you know, really, once I met my diagnosis, I was really lucky to have the right team with Dr. Bupathy at Rocky Mountain Cancer Centers, Dr. Monticelli, and then finding my surgeon was an interesting side route. I could tell that story a little bit, but basically, I really vibed with this first surgeon because we both grew up in Chicago, we were young, and he had this machismo that I was like, all right, this guy's going to take care of me. And then he wasn't in my network, so I had to argue for a while and file a complaint with the state. And while that was happening, that relationship became just a little frayed. I didn't really see him fighting for me. And I went back to my original surgeon that the insurance company told me I had to use. And I realized what threw me with her, it's Dr. Chandra Wilson, who's incredible, is that her confidence was a quiet confidence. She knew every answer, but she just answered it right then and there. And it just didn't hit me at first how good she was, what a gem I had. So luckily for me, during that process, I decided, even though I won my appeal, that I was going to go with her. And she's phenomenal. She texts me when she goes on the BCAN walks. We hug every time I see her, and we talk research. And she told me once, it was like, she's like, sometimes I forget you're a patient. It feels like I'm talking to a researcher because we like to talk data and we like to talk like that. So, but everybody, I believe, is different. So you know your patient.
Richard, do you think you had the information that you needed post-treatment for your life following all the treatment you had?
Let's see. Yeah, I think so. I think I could have had a little more instruction about how to handle the bag and this and that. That's a lot, you know, cut the tube this much and put this part on. And I kind of had to figure some of that out by myself. There was somebody that came to our apartment and showed me. And one time when I had one of my checkups at MD Anderson, I went in and asked them a few questions. But, you know, that's not a major thing. It was just something like mechanical to figure out. I think otherwise, I feel like I have all the information I have. And pre-surgery, I always appreciated what one of our other participants mentioned, and that is the percentages. Because I would ask Dr. Al-Halabi, well, what about this? And he'd say, well, there's a 32% chance that's going to happen in this amount of time. And so he always gave me those answers. Or just before the surgery, when I was talking to the surgeon, because they didn't find any cancer after I had all the chemo in the last CT scan. And so I asked him, I said, well, what happens if I don't have my bladder out? And he said, well, it's 100% certain you're going to get it again. And so I said, okie dokie, let's get her done.
Yeah. And do any of you, were you aware of the side effects that the treatments would have on you prior to having the chemotherapy, the immunotherapy, the chemotherapy, all the treatments were with you? Were you aware of, Brent, I'm going to start with you because you're laughing here. Were you aware of what that meant?
We talked about this a little bit at lunch, and I don't know, I'm not a percentages guy. I don't know, maybe my percentages were bad, so maybe they didn't tell me. I found the team I trusted, and I was just really asking more pertinent questions on, what's the route to go. And once we had that trust, it was like, all right, that's what we're going to do. So when it came to side effects, to me, it was superfluous. It's like, I'm doing this, so it is what it is. But that was another journal that I kept. I had 3 journals: the blog, like the big picture journal, symptoms, and insurance, to make sure that I was paying the right amount and wasn't getting screwed over. But the symptom journal was really helpful because I could go back and find out, oh, this is actually from my treatment, because it's really hard to understand. I've got a 3-year-old, I got a toddler at home. Am I not getting enough sleep? I'm approaching 40. Is this just that, or is this my treatment? So I would talk to my wife, and we'd pull out the scroll, as we would call it, look up whatever I'm on at the time, and be like, yep, oh, there it is. This is actually the treatment. So it helped me cope with them a little bit better. And I actually found, especially during chemo, I don't know if you guys found this, but a lot of the drugs to treat the side effects cause worse side effects than the drugs themselves. So I did a lot of it without that many drugs, because you just deal with it, go through it.
Do you think you got enough information about what the side effects of your treatments were going to be, or did you have any surprises along the way?
I got the information that I asked for, really, and that I needed, but as I went, like, for example, the Bavencio, when I was doing immunotherapy for 2 years, it started to cause, like, a tremendous amount of moodiness and mood swings and, like, anxiety, depression, and a little bit of that runs in my family, but I realized it was so exacerbated by the treatment itself. So at that point in time, talking with my primary care and my treatment team, starting to realize, oh, this is chemical. This is something that's happening to you, not this isn't you. And that just helped me deal with it a little bit better. And I was also able to get some drugs for that. I got an emergency Xanax prescription I would use once or twice a month when I was just feeling extremely anxious or depressed or angry. I would get these crazy mood swings. But for the chemo and that stuff, I just kind of dealt with it. Yeah.
Angie?
So I chose chemo, really, right? That's what I wanted. I could have went the route and just had the kidney out, and I actually said, no, I'll do chemo. So that was like my choice. And I stuck with it until like the last treatment. I think that was the one I said no more. So I don't think I got that last round. Yeah, it was, they were tough, and the doctor explained it to me, and neuropathy, and I know about neuropathies, but for some reason, I'm thinking, hands,
Mm-hmm.
walking, feet. I'm not thinking hearing.
Tinnitus.
Tinnitus?
Yes, so, tinnitus was my present I got from chemotherapy. And at the time, I just thought there was a lot of, like, crickets. No kidding. I'm not kidding.
Oh,
I swear, I thought, because, North Carolina is muggy and humid, and there's lots of things chirping, and I honestly thought, oh my God, there's all these crickets. And I believed that for a long time. And no, it wasn't crickets. It's in my head. Oh, and then when I went to my primary care doctor, because now I'm on antidepressants, just because, like, I went through a lot, and a year after my surgery, I had a stroke. So it's like enough already.
Unrelated.
Unrelated.
Okay.
Unrelated.
Unrelated,
And it's
yeah.
like, what's happening? But anyway, so yeah, I'm on antidepressants, which are great, by the way. But anyway, so
We'll be handing them out later today.
Check the goodie bag.
yeah. So, but then I was like, I told her, I said, it's in my head, because I said, oh, I've got this hearing, I hear these things, and she goes, well, does it sound like this? And I said, it's just in my head. I hear like crickets in my head, like a jungle, because it can be so loud. I swear there's everything, there's the birds and the chimpanzees and crickets and everything, and I thought she was just going to up my antidepressant or give me something else, but yeah. So I did go and see a doctor about that. But yeah, it's just in my head.
Do you still have the tinnitus?
Yes, I do. It's always there, but sometimes it's the
louder,
jungle.
Yeah. Richard, how about you? Do you have any long-term side effects?
No long term. And, one of my, this probably sounds kind of different, but one of my biggest fears when Dr. Al-Halabi explained the whole plan of all the chemo and then the surgery was nauseousness from the chemo. Because I'd had reactions to like being put under for things before. So I brought that up to him and he said, well, we have a lot of things now that can counteract a lot of that. And he made me feel comfortable. He didn't say you're not going to get it, but he said we can do things to help a lot. And when I had all that chemo, the only thing that happened to me was my hair fell out and I was really tired. Beyond that, I was walking 2 miles a day the day after I got out of the hospital, each time I went through a round of chemo. And I had a more intense reaction after the surgery because basically my system didn't want to start up again. But I was in the hospital for all of that. So,
So no surprises then later in the recovery post-surgery?
not once my system started up.
working again.
Yeah.
I would say I misspoke a little bit. I did switch from cisplatin to carboplatin because that was really rough.
Yeah.
And my tinnitus ended up getting better once I got off chemo.
Okay.
So it's pretty much gone now.
And no neuropathy?
Nope, none of that. I wish I could, if I had my phone, I could look up at the journal, but some of those drugs for the nausea, the second time I went through chemo, I just stopped taking those, and I felt so much better. So
Okay.
I will look that up at some point. I could tell anybody that's curious, but got off of those, like, this will help. Take this for 2 days after the treatment, and you'll feel better. And I was like, no, I'm not going to do that, and it was better.
Well, you all have described your experiences, and they are, to the extent a cancer experience can be positive, they have positive outcomes. And you all are doing so well, and we really appreciate you sharing all of this. I'm wondering, since we have this room filled with bladder cancer experts, what would you want to tell this room of experts that could lead to an improvement in your patient or a patient experience?
Okay, let's go back to when you said like the treatment.
Yeah.
It wasn't a treatment, but it was my first ureter, I don't know, when they go up in your ureter and they're going to try to get the cancer. And I thought it was going to be done. He said, oh, we'll ablate it and you're good. Well, don't tell me something. If it's not got a margin to be, tell me the margin of success. So I had thought, well, why not? Well, how come you didn't ablate it? What happened? So I was a little upset, a lot upset.
Yeah.
Because I really thought this was going to do it. He's going to go up there and he's going to get it, and it's all going to be great, and it wasn't. And
did they explain why they couldn't get it?
The way the renal pelvis is, it was so far up that they just couldn't get to it.
Okay.
And but I would have maybe liked a success, non-success percentage there, because I really thought, oh, good, this is going to be like taken care of. And so that was all before my chemo and going to Chapel Hill. So that was something I wish I would have known more about.
But that's a big part of the experience.
It-
Part of
it-
it is making sure you understand the procedures that you're undergoing.
Correct. And the percent of success, I'm real big on that. And my surgeons here, well, I looked him up too, you know what I mean? And I was like, is this guy good? You know what I mean? So I looked up stats on these people, you know, where did they go to school, you know, where they did their understudy research, all that type of stuff, you know. If I'm going to have someone do something on me, I want to make sure that they know what they're doing, you know. So, yeah, so.
Rookie cards, the baseball cards, look at their staff.
Yeah, I do. I look at the stats. I do.
And I mean, I always tell patients in that regard, though, I mean, not really looking at where they went to medical school or where they went to train, but how much bladder cancer do they see?
Correct.
You do not want to be the
One person.
that they've seen over the last 6 months that has bladder cancer. You want, if you can, you want to go to some place where they see bladder cancer all the time. And even though I say everybody is unique, you don't want to be unique in that regard.
Well, and that's why with mine being upper tract, so, okay, they do bladder cancer, and they do the TURPs, and they do this, and they do that. Well, that's not me, you know? So how many of those surgeries do they do? Which is why I ended up going up to Chapel Hill and having someone who does those, you know? And, you know, did a good job.
Yeah.
I would
Brent,
say to that, too, Beacon Survivor to Survivor program. I do wish I knew about that, because I've been on the other end of that now, and I feel like it would have been helpful to know things like what life with a neobladder is. That's not really something your doctor can answer. So when I had the neobladder, Dr. Wilson saved my prostate. She's like, you're young, we'll take it out if we need to. But that really keeps a tight clamp down there. So I found out after a year or two of bladder infections that I was retaining over 1.5 liters of urine. That was my own little experiment with Nalgene when she said, you keep getting these infections, have you tried catheterizing? And I was like, don't want to do that. And I did, and it made me feel so much better. I felt empty. I stopped getting bladder spasms, and now I catheterize several times per day, and it wasn't a big deal. If somebody would have told me it wasn't that big of a deal, I probably would have done it in the first place.
Yeah.
So that's a huge one. A couple other things. Obviously, with my age, don't make assumptions, you know, without the data. Don't skip steps. You guys are all researchers familiar with the scientific method, so if you don't have that test result disproving something, go out and get it, because that probably would have saved me 18 months, maybe 2 years. Who knows if I would have kept my bladder.
Yeah.
That ship has sailed. But the other thing, two other things. So one, I never miss a chance to tell everyone to test for radon. If you ever have a radon question, Google me, and I will be offended if you don't. But it's the seventh leading cause of lung cancer death out there, and I think I got some good karma from that. That's our family business, is radon test kits and mitigation. But the last thing that has always baffled me is when I was diagnosed, you know, your world changes. It's, you know, zeros in. It's like, it literally is like 6 months in a Buddhist monastery, like in an instant. You're living in the moment. You feel like you're the star of the Truman Show or what have you. But then nobody really asks you much about how you got it. Like I was expecting researchers to come out of the woodwork and want to know, well, what are all the zip codes you lived in your life? What sports did you do? What's your diet like? What water do you drink? I've never been asked any of those questions. And I do these things. I volunteer. I take every survey that's sent my way, and I've never been asked that 500-page questionnaire that I expected to get of what was your life like and why did this happen? And that's probably the biggest anxiety causer is you could still be doing something that could be causing this cancer and you just really don't know. So, researchers, we're out there and we're ready to answer your questions, so find us.
Richard, is there anything you'd like to tell this room about something that could lead to improvement of the patient experience?
Yeah, for me, as I mentioned before, support was the key word to success. And a big part of that is the mental and emotional support, because there's definitely a link between the body and the mind. In fact, the head of one of the surgical teams I had was talking to me one day, and he said, you know, over 50% of your chance for success depends on your outlook. And so I think if we can do things like have a education program for caregivers going into a long-term cancer treatment program for their partners and give them tools like the Caring Bridge I mentioned, or a plan like you use with your Google Docs that makes it a little easier for them. And the only other thought I had, and I don't know if this is possible or makes any sense, but I think if our internists, who are usually the first ones we see when things start up, could be informed like mine was, then a lot of these things could be caught faster. And so if there's a way to spread that, I know all doctors get deluged with information, but if there's a way to spread, summary reports, this clinic just did this and this is their results, and it might help the internists to get their patients where they need to be faster.
Good. Well, I'd like to open it up for questions from the audience. Do we have microphones available? I think Stephanie's going to be our roving microphone person.
And here's my rhyme for the physicians. I don't think I've said it yet.
No, you haven't.
If it burns when you pee, get a urine cytology. That's easy to remember.
So if you have questions, raise your hand. I have one more for our panelists here. And I'll start with you, Brent. How do you think advances in medical technology impacted your outcome and prognosis?
Now is literally the best time to get cancer. I am extremely lucky. If this would have happened 30, 40 years ago, I might not be sitting here. So 20, okay, let's say 20. People are always like, you're kind of like cheerful about this, you're optimistic, and like Richard was saying, that helps, but it's just my demeanor. But literally practicing gratitude, understanding this, like I'd have a pee bag on my hip the rest of my life if I was even alive. Now I can go swim with my kid at the pool on the 6th floor, and nobody knows that I'm a cancer survivor. People are taken aback. It's kind of a fun little icebreaker. You could, you can have fun with it. But it's just so much incredible research that's happened, and I'm really, really grateful to live in this day and age.
Angie, how about you?
And I'm not sure because, again, with my cancer being different, but the robotic surgery, because post-op, you end up having post-op pain just because of surgical wounds, And in my case, I didn't have a big wound. I had cute little, inch or two, entry points, and so I think that made a big difference in recovery because I didn't have a long recovery time and in pain issue. So that wasn't around a long time ago either. So I think the robotic surgery really helped with that.
And Richard?
Yeah, for me, like Brent, I don't think I'd be talking to you if it wasn't for that IAEP protocol that I went through. And then just the other, some of the drugs and other things that helped me through the process that weren't there 10 years ago, probably. I agree with Brent. It's a good time to have cancer if you're going to get it because of progress that's being made. What Kathleen always says is, our experience in Houston was a great time, except for the cancer.
That's great. Well, now you all in the room can understand the impact that your work has on lives. Petros, so nice to see you.
Great to see you too, Diane, and thanks all four of you. Fantastic session. Every year I'm learning from this session, and I'm listening to you so we can learn what is important for the patients. Just to continue the theme about research that Brent, you pointed out, I want to hear from you and all four of you. We all try, of course, to communicate better research opportunities for patients and make sure we lay them out, in a way that's comprehensible. What are your tips about that effort in general? And more specifically, would it make sense to you if there is, for example, a clinical trial available? Would you like to know about that option before you see the doctor? Before you see the medical oncologist or urologist, to have time to review and prepare questions. Just, you have any comments on that and anything in general about research. Thanks again for all of you for being here today and contributing.
Yeah, I think we might be on the same page here, but I would like to know beforehand for sure, and I would be very interested in any clinical trials.
And I think the problem with some of the trials, because I'll read about them, and you can't have had something already, or they can't have done a surgery already, or you couldn't have already had chemo, or there's parameters for all these research trials. So yes, the earlier you know about them, the better, so then you can make that path choice, because once you have the chemo, or once you go down another route, now you're not eligible.
Right,
so yeah, I think the sooner the better.
Yeah, my oncologist kept me available for certain trials, like having the foresight of different off-ramps, and he communicated that to me years ahead of time. So when it did recur, like, we knew what to do, and we just put that plan into action. So it was great.
But neither of you were offered a clinical trial? Was that part of the...
I was in one at one point. I can't remember what it actually was, now that I think of it, but it ended up...
Was it after your surgery?
Yeah, it was during my second phase of chemotherapy, and it was a monitoring. I don't think I was actually getting a drug or a placebo, but eventually they had to take me out of it because scheduling conflicts I was bad data. I basically became bad data.
Bad data.
Yeah.
Yeah. Richard, how about you?
Yeah, I've never been in a clinical trial.
Was one offered to you? Were any discussed?
No. And I don't feel like I missed anything there. For me, it's if you find an oncologist or urologist or internist or whatever that you trust, then for me, and maybe this is taking the easy way out in the short term, but I would trust them to tell me you might want to check this clinical trial out, just like they had you lined up, Brent, for some of those things.
That's why we chose them, yeah.
Because I don't trust myself to figure out, oh yeah, I should do that. Yeah. Because I'm not a medical expert.
It's the economics of specialization. That's what you guys are doing. You might not know how to make a souffle, but you know how to treat bladder cancer, and that's why we love you. Yeah.
That's right.
Great. Well, any additional questions? If not, we'll... Oh, Donna. Donna, there's a microphone on either side.
Gotta get your steps in.
Can you guys hear me?
Yeah.
Thank you. Sorry about that. I didn't realize the microphone was here. I wanted to share, I'm a pathologist, and, I'm really curious. I know you've talked about different experiences on your journey. I was wondering if you could share with me maybe some thoughts you have as you've kind of gone through looking at pathology reports, cytology, your biopsy results, cystectomy results, what you feel we could do better as a discipline that could help you. Thank you.
So that's assuming you've read your pathology reports and cytology reports and someone has discussed them with you. Is that a fair assumption?
It was discussed, and I would like to have kept the tumors in like a jar or something, put on my desk. But that was about as much as I knew about the pathology. Again, it's trusting my oncologist and what to do. It's muscle invasive, and we're going to take your bladder.
I read everything, and I'm like, ooh, this is atypical, or this is this is not normal something, or whatever, and I'm reading it all, and then I'm like, so I look it up, and then I'll go and I'll call my urologist, and I'm seeing someone also at I keep everything up there. It's a 3-hour drive from where I live, but I'm still going up there for everything, because I like a team. Yeah. And it's a team, and they can talk to each other if they have questions. But I'll call them or message them and say, what's this mean? And they'll, ease my questions, because I'm like, Carlos, was that? I asked my husband, that wasn't on the last one that they did. You know what I mean? And I have, the cavity where the kidney was, and of course, everything's so thin, and now they're looking in that area every time they do that urogram, because there might be, so there's a shadow. Well, what does that mean? So I'm always looking at it.
Do you get answers?
Yes.
and you feel comfortable.
Yes. Oh,
Okay.
yeah, because otherwise, yeah.
Okay.
Yeah, I definitely follow up on everything.
Okay.
Yeah.
And Richard, how about you? Have you read pathology reports? Have they gone over in detail?
At first, I would try to read those. That would just scare the hell out of me.
Yeah.
And so then I made the decision that I would wait until I went to the doctor that was reading the reports or that had ordered them. And I would always ask him, what's out of the ordinary? What do I need to pay attention to? What's different on this report? And then I would follow up accordingly if there was anything to be concerned about. But I think any of us could get a blood test and something's going to be way not normal.
Right.
Right.
Well, that's what I was-
Go online and find out you probably have 2 weeks to live, you know.
Well,
So,
I would say focus on making it clear to the physician, right? Because we're going to read them and we might get wound up. We're going to have questions, but as long as our physician knows what the report means and you're following protocol and you're being clear. Because every time I've read one and asked something that's atypical, he's like, well, yeah, you don't have a bladder. That's why it's atypical. It's fine. Don't worry about it. So,
Yeah.
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 You know
Yeah.
what I love? The pictures.
The pictures, the
Yeah,
actual.
I love all that. And so, and that, I'm sort of weird. But I do. I had knee surgery years ago, and I had a video of that, so it was cool. Anyway, so I do. I love looking at all the photos, and I love when you can go and, like, they'll chop it, and they'll see it in this spot. So I go through all the slides and everything. Yeah, I like to see.
Okay.
Yes, I'd just like to add one thing. Just to follow up on what Angie said about the pathology reports.
Yeah.
I think it would be helpful if instead of in a pathology report, they took it as one, moment at a time, that they look back and see if there's any change from a previous pathology report.
Yeah.
Is there any change in, like they'll use words like atypical cells and things that may cause concern to the patient. But if they would look at not just that report, but compare it to like previous reports, is there any change? I think that's what's important. Not if there's atypical cells, but has it changed, from previous reports? Is there any indication that things are going in the wrong direction? Does that make sense?
Absolutely. Absolutely. Yeah.
Hi, I'm Mamta Parikh. I'm at UC Davis. Thank you so much for sharing your journeys with us. Really appreciate it. I'm struck by the fact that you're all very fierce advocates for yourself or have advocates advocating for you. And in particular, I was curious about the insurance piece of things that Brent mentioned. Yeah. But I was curious about whether the institutions that you went to offered any support for navigating insurance issues, or whether you were really on your own with your own, left to your own devices about that, because that's something that I worry about with our patients.
Yeah.
Thank you.
Who wants to take that first? Angie?
Yeah, I'll take it first. I'm sort of lucky. Again, I'm real lucky. I wasn't 65 yet when I was first diagnosed with cancer, and up until my surgery, I was not 65 yet. And we had two insurances. So I had a government employee health insurance that we kept after my husband retired from there, but we also had TRICARE for life, because he was also a Navy vet. So we had two, and I never really had to worry about anything, except you had to keep making sure they file things in the right order. And I swear, every time I'd go, I'd have to say, okay, this is number one, and this is number two. And oh my God, then I turned 65. Now I got three. So now, after my surgery and any other treatments I had was 3 insurances. So every time I'd have to say, which order do you have them? Because they'd get kicked back if you don't do the right order. But I like the fact I can go where I want to go and see who I want to see, which was real important to me. So
Did you need help from UNC?
They helped us one time. They do. They have really good people there. And I think, especially when I went to the third Medicare, they were there. We were getting like bills, and we shouldn't get any bills because everything should be covered. And they would just say, oh, that just didn't get through right. And we just had to make sure that things were insured right. But there was people, everybody there was great. And that's one of the reasons why, even though I'm just under, not supervision, just looking and making sure I'm okay. Yeah, I go back there because everybody there knows what they're doing and they'll answer your questions. So it's a team effort. So you can ask the urologist there and they'll say, oh, well, Dr. So-and-so will be able to help with that one, and they'll get back with you, or there's a lady right down the hall in this room that can answer your question about insurance, So it's just nice. All in one place is really, really good.
Richard, how about you, especially having to travel as far as you did to get your care?
Yeah.
Did you get help with the insurance issues?
Actually made money on this deal. I was over.
Do tell. Yeah.
I was over 65, and I had Medicare and Medicare supplements, and I don't think I ever got a bill from MD Anderson beyond the $300 or whatever you have to pay. But I said I made money because we also had Aflac cancer care insurance, and that, between the surgery I had and the chemo treatments and all the different tests that Aflac pays a certain amount on, and they pay travel, it paid for our apartment for the whole 7 months and all of our expenses and all of that out of Aflac. And then Medicare plus the supplement paid for everything at MD Anderson. So we came out really well on that. I didn't need any help.
Wow. And Brent, how about you?
Well, I would say to your first comment, I think part of why you see us on the stage is it's a little bit of a self-selecting bias. Like, we are driven, independent people, and so you might want to tease what you will from that with how to communicate to the patients that aren't, right? Because I know that my oncologist had tons of resources for that, and I didn't use very many. I did use some. One of them was a program called Cover One by EMD Serono that I thought was spam a lot of times. I was like, there's no way people are trying to give me free money. I'm not going to trick me. And turns out they were, and it covered my deductible because we run our own business. So for a while we were private insurance, and now luckily this year we were able to offer a healthcare reimbursement for our employees. So now we're under a group plan. But I've always done the high deductible plans because it's like, hey, it's just if I'm going to get in a bike wreck or a snowboarding accident, and now I got cancer. So I know what I'm going to spend. I just have to match it up to what the insurance tells me. That was something I learned along the way, is don't just pay the bill right away. Make sure it matches the claim. But I would say, if the physician's office maybe pushed a little harder, I might have gone earlier to see what was available to me. But I was just driven to do it myself and put it in Excel. And I've been through 3 different insurances as many years. One of them went out of business in Colorado. I filed complaints with the state. So that's a job in and of itself, and I'm lucky to be able to have the free time to argue with people on the phone about it in between sales calls. And I'm risk averse, so I had disability insurance already. I bought it when I was 26. I don't know why, and then it helped me because I got paid out a lot when I was on full disability, which was when I was doing chemotherapy. But then once I went on immunotherapy, it did not qualify as full disability, and they ended up rescinding my disability at that point. So I was too healthy to get paid. I'll take that.
Yeah. Great.
Yeah.
All right. Well, again, Richard.
Oh,
sorry.
Hi.
Question. Oh, yeah.
Hi, I'm Courtney. I'm a clinical research nurse from Fox Chase Cancer Center. So we talked about this a little bit throughout the panel, but besides your oncologist, what resources did you have access to at your respective cancer centers that really helped you through your cancer journey, whether that's physical, mental, things like education, financial assistance, transportation reimbursement, support, what have you. I'd love to hear what resources you had access to.
Richard, did you hear that question?
Yeah. So for me, I didn't need any kind of financial assistance as far as that goes. But what I found at MD Anderson is an organized system. So most of the time they had appointments for me with the next person I needed to see before I thought of, oh, I want to talk to a psychologist, or I want to talk to a nutritionist, or I want to talk to somebody else. The appointments were there for me, and there were a couple times where I asked for an extra appointment here or there, and the resources were there so that I could go see those people. So I was satisfied with that kind of support outside of the primary treatment as well.
Great. Angie?
I was thinking about this while you were speaking. I don't think I needed anything, so I didn't look for anything. But it's there's information. They have like a cancer library that you can go in with a lot of publications and information, and there were people staffing that so you could ask questions. I think we went into it once because I have a lot of hair, and that worried me a little bit. That worried me a little bit about losing my. I lost like half of it. I still had hair, but so I talked to them about that and things that I could do, but. Yeah, they were great because then we were looking at like cold therapy. You know how to keep neuropathy away, and they have it for your hands and your feet. Well, you can do. There's caps too. That so you can lessen the chance of losing your hair if that's an issue. I didn't go that route, but yeah. So there were people there, and I did not need to access anyone, but no one talked to me about if I needed to talk to someone like a psychologist. So no one reached out to me about that.
Would you have wanted someone to?
It might have been nice later. Maybe in the beginning you don't know what you're getting into, and you don't know what you need yet. Mm-hmm. But at some point, it's nice to know what you have. And you don't want to always burden your caregiver, which is usually a spouse. You don't want to always burden them how you're feeling. So that would have been nice.
How about you, Brent?
Yeah, I think the opportunity is there at the intake, right? So you always see typically I think it's like a nurse before you see your oncologist. Mm-hmm. And I always found most of those to be a complete waste of time, honestly. I had a couple in between meeting with my oncologist where I would meet with someone lower down in the rungs who they got my history wrong so many times. I was like, I'm not having this appointment anymore. I will just kick it out 3 months to when I'm going to see my oncologist because you have old meds in there. You still think I have my bladder. Your notes aren't there. But that pre-call, I think, is a good opportunity because I was thinking about this. I'm constantly asked, do you feel safe at home? Mm-hmm. And they go right past it, maybe because I'm 6'2", and I'm 37 years old. I don't know, but I always want to make a joke when they say it because that's my personality. I do feel safe at home. Life is good. But it seems like they're trying to check these boxes and get you onto the oncologist really quickly. And I think that might be a good opportunity for somebody to dig a little bit deeper and maybe say, like, how are you feeling today? What's your mental health on a scale of 1 to 10? Have you felt like this in the last 24 hours? And don't make it feel so much like you're checking off a box or you're being interrogated, but try and make a connection. Maybe try and match somebody to the same patient every time so that you see the same person more often. Because at that point, if somebody starts to notice, Brent, you seem off today, did you realize that we have this support group? Do you realize that we have this mental health care? I probably would have taken care of that quicker. Instead, I went to my primary care. I was like, I'm feeling off. And we had a much longer discussion because I have direct primary care. We sat down for 40 minutes, and she goes, you should try, here's 20 Xanax. Use them over 6 months and see what you think. So.
Yeah, so it sounds to me like we've talked about the need for support and emotional support, and yet it doesn't sound like that was sort of part of the plan. You weren't asked the question. You weren't necessarily offered the resource if you were having
It's all over
trouble.
the walls. It's posters everywhere. There's pamphlets and stuff like that.
But no direct,
Yeah, it wasn't
how are you
an
today?
ask. Yeah, I don't think.
Yeah, got it. Karen.
Hi, I wanted to ask about patients had received any guidance on, getting ready for surgery, after surgery, and if you did, was it helpful? And if you didn't, do you think it would be helpful?
So
I did.
You did?
Yeah, in my case, they told me, especially in between the chemo times when I was trying to both stay healthy and recover from being so tired, but they said, try to walk this much a day. And start out with a little and then add each day until you build up to that. And before the surgery, they gave me some instructions for exercising that helped. So yeah, I did get some instruction about that.
Brent, how about you?
Yeah, I got instruction. It surprised the hell out of me because I was walking the same day as my cystectomy. Yeah, and then they were like, "Yeah, Data says now you got to move around." I was like, "Oh, I thought I was going to be in bed for 3 days and just eating and hanging out." And they're like, "Nope, walk to the end of the hall." So yeah, I moved a lot. I was discharged quickly, and my wife and I still remember how far I could walk down this hiking trail that we would do regularly, and it was like 100 yards. So you could still see the car. I'm like, I'm done, and I was carrying my Foley bag. I still had a grenade, everything. I'm like, that's enough for today, and we made it back in the car and went home. So, but movement, I do think it helped. It kept the GI moving. It kept your spirit. It gave you something to do. I was all for it, and I was given that guidance.
And Angie, did they give you any advice before surgery to prepare for surgery?
No.
Not just for after?
No. And it was quick, and it's different surgery, I think. Their surgeries are more invasive, it seems like. Mine wasn't. So no, I didn't get that type of information, but chemo, I got information like, just drink more water. Well, I can't drink more water. You know what I mean?
I've said that so many times.
Oh, God.
I'm like, I drink literally, I can't drink any more water. I've actually started drinking less water and using salt and electrolyte mixes because I think I was getting other side effects from overhydrating.
Yeah. Well, no, I don't like water anyway, and now I don't feel good, and now I'm sick, and I have to drink it, and it's like, it was, I don't, yeah. But anyway, so that was difficult, and so it was more, it wasn't specific enough, I guess. If they told me, you need to drink X amount each hour, that would be better for a person like me, So maybe that's something that as you get to know patients, what they need, and I don't know if everyone has time for that, but it's really important. Everybody needs something different, and I'm better with, the chart instead of just drink more water.
Direct.
And so,
Direct. Okay. Well, now we are getting out of time. I want to thank each of you so much. It means such a great deal to have you here with us and your willingness to share such personal experiences and sharing your voice with us. So thank you very much. Richard, thank you so much. We hope you have a speedy recovery. And
we will.
Thank you, all of you. This is a great start to another great meeting.
Woo.
Thank you.
Wouldn't be here without you.